Okay, I call to order the meeting of the Cincinnati Board of Education Health and Safety Committee and welcome our guest presenters, staff, fellow board members, and we will start with the governmental liaison report on particular and immediate legislative topics. And our attorney's here to
Yes,
do that for us.
you are stuck with just me this month. Really, the main part of the report is under recent. We did a CPS State House Day and set up meetings with Krista Boyle to meet with representatives and senators. And also we set up a call with her and Gail Manning, who is chair of the House Primary and Secondary Education Committee. And then we set up a call with Senator Blessing and Treasurer Wagner, coordinated the meeting with CPS leadership and SORTA. We just set it up. We did not facilitate. And then the House and Senate won't be back in session until September. So there's not much formal meetings and things along those lines because August is a kind of a vacation month for the legislature. But there's a lot of plans set for September. I imagine that they'll have meetings through September and the early part of October, then take a break, and then start up again maybe a week or two in November, and then finish out the year, maybe second week in December. So we're probably looking at about 8 more weeks of session before the end of the year, maybe 9. So that gives you an idea. And then what we've done is just put little asterisks by certain bills that may be of interest, coming up in the next month. So that's essentially it. We passed the budget already passed. We already went through that. I think that when things settle down a little bit in terms of our transportation issues, we should probably invite the legislators in for breakfast. If you remember, a couple years ago we did that. I thought that was a big hit. This is an quote unquote off year, so it's really good to do it now because you don't have the political pressure up at the State House. So we'll work with you and Krista to set that up. And if you could pick the high school that we go to, or I guess we could do it here. I always think it's better to do it at a school. And so we can do that. And then there's going to be a new head of the Ohio Department of Education, and so we'll get that person to come down and visit the school and tour with the superintendent. And so when all those things kind of fall into place, we'll make sure those relationships are established or renewed. I didn't know if there was any issues or things that you would want us to address. Any burning issues?
Any questions, issues we can have on the legislative liaisons, governmental liaisons address?
Sure. By any chance, have you heard any chatter around or issues around transportation down here?
Sure, of course.
You're right. How that's going in that dialogue?
Well, so what I've done is I've explained to people that there's, depending upon their approach, I've just said, there's more than one way, there's more than one side to any dispute. Obviously, CPS is clearly motivated to get as many kids to school on time. It makes no sense for us to have any other position than that, right? That would be absurd to suggest anything. And so just basically following the position that Krista and Dan have set forward and just repeating that message, and that's been what we've done. I think, as I said, I think it's very important that we kind of communicate to our legislators hey, this is how we worked everything out. Whatever bumps there may have been the first day or two have been worked out, which happens every school year. There's nothing unique about this school year compared to others in that one particular respect. And we've solved it, and we're doing a great job with that. So at some point, I think we need to have a sit down with them and just explain that. That would be what.
So they think so. We've solved our transportation problem.
No, I'm not saying that. What I'm saying is we have been able to overcome what might be viewed as a setback or a problem or an issue. And so kind of the way that we have positioned CPS throughout is that we are creative problem solvers, that we're people who create solutions for students and their families. And so this is another example of that. So we had a situation that was tough for whatever reason, right? I don't get into any of the background. But we've overcome it by thinking creatively and using our resources wisely and things like that. Now, we've got to go back a little bit. When we were talking about the budget, you might remember when we went up to the State House, I think we had 5 points, and point number 5 was transportation. Like we needed more money for that. So there's a school of thought that says, hey, maybe you should have listened to us a little bit more when we said that. I mean, I don't remind people of that. I'm not going to shove it in their face, but that is part of it.
Yes.
One thing that I thought I knew this, and maybe you could help me, because I'm pretty sure that the other urbans have a similar plan to what we have across the state. And I believe it's correct that it is not required by state law to provide transportation to high school kids, right? Mm-hmm. So therefore, then why would they fund that any differently, right? It's not a requirement. So clearly somebody said, hey, this is an issue. This is something we feel is necessary for you to require. So therefore, it's not going to be dollars. I think there's an element of making sure the public knows that, because the conversations I've had live today with families who have brought that up, they said, well, you're required to do this. And I said, well, my learnings, frankly, is we're not required. And many don't. And then I bring up also the federal law where our region kind of got in trouble because they found out we were doing special routes, and that's against the law. So anyway, I think it's about parceling some of these things out that I've learned since this began. The one as it relates to, well, you should just pay this because you're required. Somehow, some way, understanding that this is a, state policy. So why would they provide dollars? If you want to get that changed, then we could ask for more funding. But we got to first make sure people know about that. Because then when I say, it could be another levy. If we were to bring Yellow Bus to everybody, like there's not another 40 million hanging around. Well, we could do another levy. So I think, there is that element of understanding what the state law says and requires to do and help people understand that. And that's a different body than the school board to change that guidance so that then there is a desire for additional funding in transportation. What we're asking, in this case, it's high school transportation funding. They're not going to do it if they don't believe it's necessary.
So the way that I understand it, it's transportation for 8, 9, 10, 11, and 12th grade.
9 through 12.
Oh, it's just, so 8th grade.
Now, 7th and 8th were required to transport.
Right. But that we're using the extra routes, it was 7 through 12, not 8 through 12.
Right.
Okay.
Because, it was an equity issue because, well, there's a couple of reasons. One is that we found when we paid for transportation for the high schoolers, our attendance went up.
Mm-hmm.
And the other is, unlike the other urban districts, we have high schools of choice. The kids are going to school all over the place. So if things don't really change, we may be forced to limit that access and have kids go to school closer to where they live, require them, to go to West Side schools if they're West Siders and East Side schools if they're East Siders, except for Walnut, of course.
And then CPS.
And a CPS, right. They're kind of in the middle. Walnut's definitely east. But, yeah, there's kids. And, Clark and Gamble, which I hope we're figuring out, kids would apply to both, and kids from the west side are going to Clark, and kids from Clark from the east side are going to Gamble, and that's a big problem too, transportation-wise, anyway. So we may be forced to limit choices for our families, but the charter schools won't be forced to limit choices. That's the thing.
Well, I think that's kind of one of the hallmarks of CPS is having that
Yeah.
fight, my opinion.
Right, but if we can't transport the kids less than, in a reasonable amount of time, that's would be the next step. So we're not providing equity, because schools are different. But yeah, this is, I must say so, a very classist issue.
Those who can.
Mm-hmm.
Or don't.
So it's a shame.
So I think we should have a meeting where we explain kind of our issues and solutions to the legislators. And whenever the superintendent or you, Madam Chair, want to set that up, I'm happy to do it.
Superintendent, would that be something that you could put into your schedule?
Yeah.
I think that's really important. So if you you can work with the superintendent's office, I'm probably a little more flexible than she is, so be happy to help.
So yeah, so maybe we could do it at a school. If
As
you
soon as
want.
you email me, I'll give you my available dates along with Crystal Ball, and we'll make that happen.
Okay.
Maybe a school like Clark where kids are coming from all over, kids can talk about their bus rides. Everybody knows about Walnut, Walnut, that's the strong advocacy. But these other schools, we're not hearing as much from.
Okay. So yeah, I did that.
Okay, good. So we'll set that up. Anything else from the committee? Oh, thank you very much. Thanks for coming in person.
Yeah, I tried
Good to see you.
Yep. Okay, there'll be a lot more next month. I guarantee you that. I can guarantee you.
And once we get through this opening school, I think we'll have capacity for more stuff.
Yeah. Hey, and now we are going to combine number 2 and number 5. Because we have things together.
Yes. Hello, everyone.
Hello.
My name is Dr. Carrie Bunger. I'm the Director of Positive Culture and Safety, and I am here representing Assistant Superintendent Susan Bunty, and to provide updates, as Board Member Bates stated, in mental health as well as granted. And so next slide, please. I am excited to share the following updates with the health and safety in regards to this information. So for social emotional learning, last Tuesday, I believe, in fact, the Positive School Culture and Safety Department, in collaboration with the field and other departments like curriculum, early childhood, and Department of Student Services. We collaborated and executed a all-district school staff training and trained 5,000 staff within social emotional learning with a focus on disproportionality within discipline, positive behavior intervention supports, and social emotional. All those key critical pieces are intertwined and support one another, and impacts how we approach our students, how that definitely impacts our discipline. So it was a district-led PD, but everyone was in their building and looked at their own building data from 2018-19, and we provided supports within the Schoology to help with training around topics like implicit bias, vulnerable decision points, as well as the key components of social emotional, how we can continue to work forward with the ultimate goal of decreasing our discipline rates and increasing emotional skills for our students. We also have increased our imprint on restorative practices, and we're able to train the staff at the Promise Center, as well as this week we'll be training all of our alternative learning center paras in restorative practices, with the idea that we would start there and then continue to increase the imprint on how restorative practices can be used within PBIS at the building level. School social workers, we are incredibly blessed, thankful, and appreciative of being able to increase the number of school social workers at CPS, onboarding 38 new school social workers. With that came a significant amount of training on the role, with a focus on we want to make sure that school social workers are able to do Tier 2 groups consistently, addressing the unique needs of our students coming back. We know that some students during COVID-19 had the best time of their lives in terms of being able to be home, or they thrived in different learning environments, but we also know that we have students that really had difficulty during this time of change. So in preparation for that, we have school social workers at the ready to do groups that are tailored to the needs of schools, and of course continue work within positive behavior intervention supports and attendance. I do want to share with you, and I've spoken with Susan Shelton at Mindpiece, that as with the staffing shortage across the U.S. and in the city, there is a shortage of therapists. There will be 5 schools, 5 elementaries and 2 high schools where we're looking for Mindpiece therapists to help support. We do have a plan in place between Mindpiece and CPS to make sure, number one, that there's going to be crisis support no matter what by our school counselors, school social workers, or psychologists, and that we can still provide supports and referrals for therapy if needed. We just may refer to outpatient or through telehealth to be able to provide supports that way. So we are actively working with those particular schools where they have access to mental health supports. Again, we know that that is going to be needed at this time. So that concludes the updates in terms of social emotional learning and mental health. Jumping to Grant Us Hope, I will tell you that I spoke with folks over at Grant Us Hope. That name is, of course, Holly End. It just came back at Grant Us Hope, and said that the updates have been completed. So the last time we spoke with the folks there, they said that they were updating the curriculum to be increasingly culturally inclusive, and that a lot of the feedback that was received when piloted previously was that it was reflective. It was developed in, I think it was Idaho, in such a way that it wasn't reflective of our population here in Cincinnati. They took that feedback, received that feedback, and have finished their updates to the curriculum, and we'll be reaching out to Bunty and myself to come back to the table so that we can share that information. They just completed that. So I just wanted to provide that update that they have been working on it with the intent of making sure that the lessons are inclusive and reflective of the body that we have and serve here in Cincinnati. I believe those are all of my questions. I'm happy to answer.
Yes, Ms. Bowers. Yes, thank you, Dr. Bonder. I wanted to CC the barrier of workforce development in mental health agencies, period. So I'm glad you pointed that out because that is a issue
Yes.
going on in multiple agencies right now. What was brought to my attention from a parent was she was inquiring about the services. I know we've hired a lot of social workers, services specifically for immigrant refugee population, and some collaboration with Catholic Charities may not be going as well as expected. But the question was, how are we serving that population of students and meeting the needs of specifically our refugee students that are coming to us?
So I can answer that we have tried to partner with Catholic Social Charities and have set aside funds to recruit and retain a bilingual therapist. We have not been successful in retaining a bilingual therapist, so that regardless of immigrant status or if eligible or not, that they would be able to have access to care. That is our intent. We have not been successful in finding someone to date. We do have two EL school social workers, so we have two bilingual school social workers speaking. And then we have a third who is supporting Project Connect as well as supporting students that are enrolling to the district. So we have a total of 3 school social workers that they're bilingual in terms of they speak Spanish and English. I don't think we have any French speakers yet. But regardless of Medicaid eligibility, provide those supports or immigration status through the work of those school social workers. So we have split the district in half by the 2 hubs. So like Dater and the west side, and then Lithrow and the east side, and then the third school social worker is supporting Project Connect and enrollment. So is that enough? We can always do more, but students will be able to access those levels of irregardless of Medicaid status.
So they would get prevention support, but they couldn't get therapy.
Correct. So that's why we're really searching hard for them. Yes.
And the second question, if you don't mind, Madam Chair, is regarding Grant Us Hope.
Yes.
Thank you for updating us on the added information to the curriculum. Is there any data on implementation of this added curriculum or added parts to the curriculum? Because I think I would need to see the effectiveness of just sticking papers in to say that we have this.
Sure, and I understand where you're coming from and can certainly convey that. So my understanding, this has not been piloted as it stands anywhere for there to be data, but I will follow up to sure it's according to Grant Us Hope evidence-based or evidence-informed, but I will certainly go back and ask about data specific to this updated version versus the previous version. Happy to do that.
Yes.
I think that whole slide, maybe one of my colleagues would give some of that in kudos tonight, because those are, we've heard a lot, like, hey, we should do more in this space, whether it's public comments, some of our surveys. The sheer number of staff that has participated in development, 5,000 is, that's basically everybody. That's phenomenal. Everybody's part of this journey. I think adding the additional social workers, I actually talked to somebody just, Chairperson Bates and I were talking to somebody who said, now I regret not applying for one of those new jobs, but they were filled and last night. So this, I think it's important to make sure people know that we are doubling down in this space. So it's a really great story. So thank you, and please take that back to the entire team in an area that I think there's a lot of desire and passion. And clearly the right people are at the table there. So thank you for that. And then while it's maybe not germane specifically to your presentation, I think it's under the same department function umbrella. Can I ask a question about that? I think huge kudos to Aiken, their autism unit. A parent said they have been so impressed. And they said, on the couch, it has been 2 days. They are so impressed with that autism. And the question was, it was very different than their experience at another location. So the call to me was, I just got to tell you how great this is. Now, it's a little further for us because we're over on the east side, we're going over there. But 2 days has told us we would drive 3 hours for that. So I wondered if it might be able, if I could connect somebody, this particular parent who I guess is part of a network of parents of CPS kids who have been diagnosed with autism. But I couldn't miss the opportunity to say how thrilled, again, got to share more of these positives. They just could not stop talking. Whoever is doing whatever they're doing, they should be commended.
I could certainly pass that along to Dr. Hall. Would that be appropriate as well?
Dr. Hall and Susan Bunting.
And Susan Bunting. All right, thank you very much. I will pass that along and hopefully we can make a connection.
Yeah.
Thank you.
Hey, anything else? Okay, COVID-19 pandemic, and you don't have to duplicate here what you're going to give at the main meeting, but.
Yes, so I'm not making a presentation later tonight.
Okay.
But I can just share this update very quickly.
This is great.
We do have a change in the community rates from where we ended last school year. So let me just kind of go over that very quickly. What you see on what's labeled as slide 2, this is our City of Cincinnati daily new cases, and we are at 29 per 100,000 now. We had gotten down to as low as 2 this summer. So, as you've seen with the rest of the country, our community rates have gone up earlier this summer. The positivity rate in the City of Cincinnati is 8.2. So just to mention the school measures, which is on what's labeled as slide 1. We're reporting 2 in-school transmissions this school year, and that would start with starting when Just Start started. Is kind of officially what we're calling this school year. No classes currently on distance learning. We are up to 1,254 student positive cases since the beginning of the pandemic, 660 staff cases. And then there is our staff attendance, and that was effective as of last week. So again, we're watching, these are the numbers we're continuing to monitor to see if we need to adjust any of our safety protocols.
Any questions? Yes.
Thank you. So the number, the positive cases for staff and students, that has been a cumulative.
That is a cumulative.
So wondering if we could also segment out this school year.
Absolutely.
Obviously with all the other changes in the world,
Yeah.
I think it'd be very helpful to have that broken out.
Absolutely.
And it's maybe good to have the context of but I think people are more concerned about new school year,
Yeah.
what's good numbers.
Yeah.
So that would only be my suggestion there.
Questions, Ms. Bauer?
Thank you.
Well, do in-school transmissions since when?
Since Jump Start started August,
Second week of.
second week of August.
Okay. And is that for students or staff?
It's either. Could be either.
Yes.
With percentage implementation of safety protocols, can you explain why that would be under 100%?
Sure. So we do a daily staff survey of distancing, masks, cleaning protocols, to make sure that those things are happening in the buildings. And so when we ask all of the employees yes or no. So when we have a no, we go to that building, we address it, and we try to correct it. So that every day, every employee is asked to answer those questions.
So today I received an email from a parent from a school, from a Montessori school on the west side, who was concerned, and I don't know, Superintendent, you can verify if this is still an option. She didn't feel comfortable about some of the masks down, they were eating popcorn, what have you, in the classroom, they weren't practicing because of Montessori or whatever. But she had asked, and you can clarify, if she wanted to remove her child from the school to sign up for CDA, could she come back to that school when things were safer, she can get her child vaccinated? And I don't know if this is going to come up once the second time that someone is asking.
Yeah, we kept that in place.
Okay.
So if you leave for safety reasons here, but what's different is those high schoolers, those seniors, the state is saying, you can move, but that's your diploma. So if I left Park to go to CDA and finish out at CDA, your diploma is going to say CDA. So that's the difference, but we are still allowing people to make that decision to go to CDA.
I'm just thinking as time progresses in these cases, you
Yeah.
see more transmission, that's going to be a bigger
Yeah.
question for a lot of families, and I just want to make sure that that question was the same or not. If not, we need to make
Yes,
it.
we kept that open.
Okay.
Anything else for Ms. Trimble Oliver? Okay. And school resource officers update, because it's always on our agenda. Good afternoon.
So the last time we were together, we were asked to put together a timeline of the work that had been done or is to come around our school resource officers. And Superintendent Amott suggested that with the timeline, we include goals. So I started the timeline with the implementation of the Speak Up, Speak Out, which you know will be in all of our high schools this year. Whole year, we did work with them to talk with our parents, our students, and our high school principals. We did have the ACLU conversation, myself and Dan Hoying and Sarah on the telephone. You guys visited the cadet program at Hayes. So in July, we did take a look at the memorandum of understanding, and Dan did find a very old SRO program document from 1989. So we did have the opportunity to read that. Sarah has hired a new security director, and I'm not sure what day he starts. Tomorrow, and his name is William Bell. So Mr. Bell will be at the meeting that Sarah, myself, Dan are having to move forward the work. I also meet with Cohere on Wednesday. We're going to work with them to get a little bit more community insight as directed by the superintendent. To look at focus groups, and those focus groups will help us to determine what measurement and monitoring will take place, and then we will level set expectations with our principals as you have suggested, and our plan, if it's acceptable to you, is to bring back a recommendation.
The recommendation would be a plan, or what would the recommendation entail?
So whatever format you would like. So the Cohere work, in my mind, you have the staff, the principals, the students, and the parents. The community insight will be included in that document. If you haven't had a chance to see the former 1989 agreement, if that's of interest to you, we certainly can provide it, and whatever other direction you might want to.
I would say, Ms. Murphy, you can go over the goals, because that's really kind of next step of what we would like to accomplish with the community engagement along with hearing from, our students. So if you can just
Yes,
read
ma'am.
those.
So, one of our board members had also inquired saying that, there's a lot of information about the negatives of having police working with our children. So we, did some research and found some articles that demonstrated the contrary. So that was sent maybe, last week or 2 weeks ago. So what we wanted to do was, take all of that data that we had and review the MOU that we currently have. So that is a goal, to immediately do that, provide ongoing professional development. Dr. Bunger mentioned to you the opening of the Promise Center, so she's included in this document as well. And the redesign is listed there as a goal. So we have done that. Now the implementation of when the students come, the type of interactions that they get from adults and the learnings that they will take back to their home schools once their time at the Promise Center is completed. We've also already, Dr. Bunger and her team, completed putting an alternative learning center in all of our schools. And she also mentioned the professional development. Our paraprofessionals will take part in most of those ALCs are staffed by paraprofessionals. And then finally, collecting the data to highlight the results our SRO program, how amazing.
So why would a child be placed in the alternative learning center rather than Promise Center?
So the Promise Center is designated more for a Category 2 or a Category 3 offense. Something that is deeper than what a paraprofessional in a school might be able to provide a service for a student. So the ACLU is ALC, I'm sorry. A little bit more minor offenses that maybe it rises to the impact that an administrator needs to step in above and beyond what a classroom teacher might do to correct a student's behavior. And you want to do it better than I did.
Fantastic, assistant superintendent.
That was good.
Typically, a student would be assigned to the alternative learning center within the school for a Category 1 or some Category 2 offenses. And it can be utilized as a timeout for a bell or a short period of time, or it can be a day-long consequence. But during that time, students are reflecting on their behavior, and Sarah has materials from Boys Town Press that help them lead the students by a developmental level in reflecting upon their behavior, their choices, and making an action plan upon returning to class. The idea is that there are going to be times and opportunities where students need that ability to reflect with an adult, a trusted. But we want students to stay in school. And so if we can minimize that disruption to learning and have the student return back to class either the next day or the next bell, then the student can access the high quality education him or her to be able to access, but still allow for an opportunity reflection. So that's the difference between Alternative Learning Center, ALC, and then the Promise Center that's more Category 2, 3.
Yes. Thank you, Assistant Superintendent Murphy. What I'm looking for is data and baseline on the conversation that's out in the community from our friends from CPD and CPS. I can't think of the name right. I almost just
ACLU and the Young Activists.
Thank you. That's what I'm about the data and the number of students who are being arrested and ABC. Do we have a baseline of discipline around just numbers, and then that can determine, like, from each school, like how that looks in each school, and if that can be a baseline to
We can
decrease
get
it?
to student discipline data from our schools, no problem. But the problem with that ACLU report, in our mind, myself, Dan, I think Sarah would agree, you have to break out the SRO data. So we don't feel like we have that. We're not sure still to this moment where Young Activist Coalition or the ACLU got the SRO data. We have done a records request with the Cincinnati Police Department and have not, that was done back in, I want to say, We still don't have that to date. So, Dan and I are not at all certain where Young Activist Coalition and ACLU, where they're getting this data from.
Well, I heard from the Inquirer reporter that the ACLU got it from the police department and she has it. So why an Inquirer reporter would have it and we wouldn't have it, I don't know.
But what we're saying is some of that data on the ACLU report, we would dispute some of that because it seems they combined our student discipline data with whatever police data they have.
Right, but they have police data. So it's my understanding that the Inquirer reporter has the police data not combined with our data.
I want to finish a little bit.
Okay.
You said it was broken out. Is there a baseline that we can use from schools? Because I know we document when students may have had a correctional kind of episode. Do we have that data from each of our schools?
Yes, we do have student discipline data. That data does not necessarily reflect any interaction
With the police.
Am I hearing you correctly that your interpretation of the data is they've got things that might have happened in our schools or things that might have happened with these youth out in the community?
That could be true as well. So, for example, Board Member Messer, if a student has a runaway warrant, an arrest might be made in a schoolhouse. Well, that's not a behavior that necessarily was initiated by the school, but an arrest was made on one of our properties. If a student has a warrant for being incorrigible, Cincinnati Public Schools wouldn't have necessarily filed that warrant, but if a parent reaches out to the school, the SRO may arrest that student on one of our properties.
So the follow-up to that, I think in absence of data, people make stuff up. People get data, and they don't always position it appropriately, especially if it's trying to drive case they're trying to make. Not saying that's being done here particularly, but I think we have to put forth our data. Here is our data. People can put stuff out and pull it from over here, but we can only be accountable for the things that are happening within our. I totally agree with that and how we represent that. And then I think the only enhancement I would do to this is when I was on policy and working on the anti-racism policy. One of the suggestions I made was that we put a task force that was representative of like these 10 stakeholder groups. So I think if you list which stakeholder groups, I think we should have a principal represented, some teachers represented, some parents represented, some of the community, NAACP or whoever. Maybe we look at who we have at the table for the anti-racism policy, because not that it's bad we're hearing from one group, but they are one group. There are a whole lot of other people out in the community that if we engage them, it'll give us a much more comprehensive view, not the least of which, though, is our school community and that type of thing. We can't make decisions simply on students. Students have to be a part of the conversation, but we also have lots of other partners in this wheel that we're all a part of. So I think we're very thoughtful about listing all of those stakeholder groups to make sure people can say, oh, okay, people like me are included in that. And then we have to trust that group to make the recommendations for us to go forward. And I think we just have to grab that and just say, hey, like you've done here, here's a plan. Here are the people that are going to be at the table, or at least the groups that will ask for representation. This will be a comprehensive review, and then we make that recommendation here. But I think we have to empower that group to do the work, and hopefully us as a board can trust the process and then, provide some feedback on whatever comes from that group.
Yes.
request. Is it possible, I did read the memorandum and understand it, but there was a lot of gray in there and not a lot of accountability on the side of our SROs. And this could be our decision as a committee and present to the board, but I would like to see some type of a data collection and collaboration with Mr. Bill, which I'm pretty sure is going to be part of his role, with SROs regarding, so that we can track certain things that we're saying that we're not able to track because it's all convoluted. So can we agree that that might be moving forward so that we can get a better idea of that type of the allegations that these are the visible numbers and no, they're not, or what have you. Okay. And maybe it should be specifically stated in the MOU that that is the expectation with the SROs. Thank you.
We understand what data we're looking for. I think that'll be helpful. Because right now, situation where the students are being advised by, well-connected adults, and it's a small group, but, they're pretty vocal. So we need to get our data and, what we believe is important and which belongs to us and which belongs to the SROs. Anything else? Okay. So we're on to other business, and Ms. Bowers, you said you had something?
I do have something the same vein a little bit, but more so students that are in juvenile detention. 120, I guess is what it's known as. There was a reach out to me from a person at Woodward who says they have a program there where they are following data on some of our students who are falling through the cracks that are in and out of juvenile court. You said there's a program. I want to know if you were aware of this program or this focus for the high number of students at Woodward who are maybe frequent flyers at juvenile court. Her name is Andrea Spinney.
I'm not aware of that.
Okay.
Isn't Andrea Spinney a teacher?
She's a teacher at Woodward.
Yes.
She was wondering, concerned about that, doing an expanded program regarding students in juvenile court who may not be.
Is she requesting a program?
She was saying that they're doing some intentional things at Woodward, and she wanted to see if there were some things that we could spread out across the district because of the high number of students that are of our students that are going back and forth in juvenile court and then falling through the cracks academically.
Dr. Margaret, that's under you? Yes, Dr. Margaret will follow up. Andrea Spinney.
Yeah. Thank you. That was it.
Is that it? You have anything else to do?
Can I make one request?
Yes.
Is that when teachers or principals reach out, if you can send them directly.
That's cool. I didn't know she was a teacher.
She's a teacher.
Okay, I thought
so
she
it's
was
not
a
a
parent.
program. She's a
Okay. I thought she was a teacher. Okay, all right.
Yes. Did she email you? Because you can just forward that to me and then I can.
After she called me. She called me on the phone. That's why I really didn't know who. But I just thought she was a parent.
Okay. So if you can follow up with her regarding the program and I'll follow up with regards to proper procedure.
Anything else? Okay. Finished a little early. Right. Yes.
I guess, so what, that's not on the agenda, but in that other business, I know there are two topics that are on board discussion or board matters tonight. Safe routes to school and Vision Zero. I think those will likely come back to this committee, right? So just, hopefully we can kind of bring those. And then I think probably what falls under that is, we get a question like whether it's one of the metro stops or sidewalk or whatever, creating a process where you make sure you get it to the right place. So probably would be this committee for kind of those ongoing updates and that kind of thing. So just want to make sure that's, I was thinking through that's where that would kind of fall under health and safety.
Yeah, who put those on the agenda?
Ms. Bolt. Yeah.
Mhm. Okay.
Yeah.
Yeah, I'm sure we're here.
And then I guess the other one is, so somebody else put on like COVID-19 data. So it's in this committee. Like we're going to be doing it on both. I think let's figure out where it goes. Like we're going to keep putting on board matters. Or if it stays in this committee, but I think that's another one. Hopefully we can just reduce the duplication of topics.
Well, who put COVID data on?
Mr. Morosky.
Well, why don't we give him this presentation?
Yeah.
You want a hard copy?
Yeah,
Yep.
and that way he can ask questions.
Okay, good. But maybe it'd be good as chair, maybe you could know that this committee is going to continue to stay on top of that as part of our meetings, so we can determine at what point we want to take anything back to the board.
Well, I mean, he put it on the agenda, but did he go through you or Carolyn to put it on the agenda? I mean, because he could have been told that we have it on our agenda. Or did he go right to Phyllis?
And I tried to make that case on a couple of these topics, and they went back to Phyllis. I'm not going to put Phyllis in that office. Very adamant, so they got put on it. But I think it'd be a great opportunity to discuss kind of our protocol, so that we're not double covering things. Because if we're end up covering it there, then why are we wasting the time of our staff?
Well, right, that's why I asked. Sarah was going to be sharing this meeting, and at least now be prepared to give it to the board. And if they have any questions, they can ask questions.
There will be part of our minutes, though.
Hmm?
Yeah.
Yes.
It just makes sense. The regular board business meeting, because it's going to change often, and we only meet once a month. Right?
And we meet twice a week.
Right, so the information would make sense, because it's probably going to change that fast. In my opinion, not on this agenda, unless you just want.
Well, it's interesting too, because this data, the community data, as of August 22nd. Yeah, it's very interesting. Okay. Okay, anything else? That's it for this health and safety committee meeting.
Thank you, everybody.